You think of a hospital, you think of a place meant to heal, a place of faith. You think of a place that's meant to protect. But what happens when that trust is completely shattered? We're about to pull back the curtain on the dark secrets of a hospital where the sacred oath to save lives was allegedly broken, all for profit. I took an oath to serve the public. Just listen to those words. They're from Amos Kiprop, a radiographer who put everything on the line to speak out. You know, his fear wasn't even for himself. It was for the patients trapped inside a hospital where that very oath was being ignored.
And this is where it all went down. Systo Mazoldi Hospital. Now, people chose this place specifically because it was a faith-based facility. They believed that guaranteed a certain level of compassionate care. We're about to see just how tragically wrong they were.
So, let's begin with a story of deception. And I mean, this was a calculated, unbelievably cruel deception, with a young mother right at the heart of it. This is Agnes Chalangat. She was just 24 years old, a farmer and a shop owner, just full of life and so excited. She was literally counting down the days to meet her very first child. A moment that should have been pure joy, but instead it turned into an absolute nightmare. Okay, let's walk through the timeline of Agnes's last day. She gets to the hospital in the morning, she's taken for a C-section in the afternoon, and by 6:45 p.m., a whistleblower gets a call. The news is devastating. Agnes has died. But look at this last time. 9:30 p.m. That's the time the hospital management allegedly wanted to put on the official record. Why? Why would they do that? It was all about creating a false story, to make it look like she died long after she had left their care. And here it is, in black and white, the physical proof of the cover-up. In the original report, you can see the anesthetist first wrote dead, then desperately scribbled it out and changed it to referred. The falsified version they sent to officials, well, that one went even further. It claimed the C-section took an impossible 4 minutes and insisted Agnes was alive when she left. The deception here, it just went to horrifying lengths. The hospital actually delayed this supposed emergency transfer, making everyone wait for Agnes's sister to get there. They then put her in the ambulance right next to her sister's body, telling her she was just asleep. And the final cruel act? They staged a sudden stop on the road just to pretend that Agnes had only just passed away. It's just unthinkable. So this just raises a chilling question, doesn't it? Was this elaborate, cruel cover-up just a one-time thing, a panicked mistake, or was it actually part of something much bigger? Well, the answer is deeply disturbing. No, Agnes's death was not an isolated incident, not even close. It was part of a deadly pattern. Just 1 year before Agnes, another mother, Jacqueline Chetnich, also made the choice to go to Systo Mazoldi because of its faith-based reputation. And just like Agnes, she would never leave that hospital alive. In Jacqueline's case, it all came down to a fatal delay. She had serious complications and an ambulance arrived for an emergency transfer. But get this, the hospital management refused to let her go. They forced that ambulance to wait for a critical 90 minutes. Eventually, it had no choice but to leave for another call. Just 30 minutes later, Jacqueline was dead. So what was the hospital's justification? If God decides to take a life, then he decides. That was the actual response from the sister in charge after she refused to refer a critically ill baby, who also later died. It just reveals this chilling mindset, using divine will to excuse what looks an awful lot like fatal negligence. So why would a hospital do this? Why delay life-saving care? Well, the motive was brutally simple: money. And that brings us to the hospital's ghost patient scheme. Take a look at this number. That's the value of a single fraudulent insurance claim. It's the amount the hospital billed the state for a surgery that never even happened, on a patient who wasn't even sick. This is just one tiny window into a massive, organized scam. So here's exactly how it worked. The hospital claimed one of its own employees, a man named Justice, had a thyroidectomy. The state insurance authority paid out, but an ultrasound later proved Justice's thyroid was perfectly healthy. He was a ghost patient, and his identity was simply used to steal public funds. And this wasn't just one kind of fraud. Oh no, it was a whole web of corruption. They created ghost patients, sure, but they also allegedly coerced staff into the scheme, evaded taxes, pressured doctors to fake diagnoses, and even set daily admission targets. Anything to maximize profits. Now, this greed didn't just exist on paper. It translated directly into a systemic culture of cruelty towards patients and the ruthless silencing of anyone who dared to question it. I mean, the human cost was just immense. Patients who couldn't pay their bills in cash were allegedly denied food. The hospital refused to issue receipts to hide its income. They even employed an unlicensed nurse. And whistleblowers claim, and this is just awful, they claim the hospital would even hide medication to push mothers into having more profitable C-sections. Two staff members, Amos Kiprop and Wickliffe Nachubas, saw all of this happening and they tried to stop it. They did the right thing. They went through the proper channels, reporting the fraud, the negligence, and the abuse to both the hospital and to government authorities. And how did the hospital respond? With pure intimidation. After these guys refused to sign new contracts designed to silence them, they were forced into the back of an ambulance, sirens blaring, and driven not to the diocese as they were promised, but straight to the hospital's lawyers. And when they still refused to back down, they were fired. But you know, the hospital wasn't the only institution that failed here. The whistleblowers took all of their evidence to the Social Health Authority and the Kenya Revenue Authority. They made the calls, they submitted the documents, and yet, no meaningful action was ever taken. The hospital was just allowed to keep operating with impunity. And all of this brings us right back to where we started, to the very foundation of trust this hospital was supposed to be built on, and how that faith became nothing more than a facade for truly unthinkable acts. Just remember why Agnes and Jacqueline went there in the first place. They chose Systo Mazoldi specifically because they believed a faith-based institution would provide a higher standard of care, something guided by real principles and compassion. They put their trust and their actual lives in that belief. The dark secrets of Systo Mazoldi are now out in the open, but it leaves all of us with one really unsettling question. How many other institutions out there are hiding behind a cloak of faith while completely abandoning their most fundamental duty of care?